name is Rhonda Vaness, and I'm completing this video for advanced health assessment. Can you please state your name and date of birth?
My name is Jacob Vaness. I was born June 2nd, 2006.
And Jacob, can you consent to being in this video?
Yes, I consent to being in this video.
I'm going to start with an environmental scan. First, I would start by closing any curtains to provide the patient privacy. Then I would confirm patient identity. Can you state your name again for me?
Jacob Vaness.
And your date of birth?
June 2nd, 2006.
And then I would check the patient's wristband to confirm that I have the right patient. So Jacob, what brings you into the clinic today?
I have a cough.
Okay. Can you tell me a little bit more about your cough? Is your cough a wet or a dry cough?
Wet.
Wet. Okay, so you're producing some sputum.
Yeah.
What color is the sputum?
Green.
Green. Okay. And is the sputum thick or thin?
Thick.
Thick. Okay. And have you ever noticed any presence of blood in that sputum?
Occasionally.
Occasionally? Okay. And when did the cough start?
Around a week and a half ago.
Okay. And is the cough persistent or intermittent? Does it happen more in the morning or at nighttime?
More at night.
More at night. Okay. And are you experiencing any pain related to the cough?
Yes.
And where are you having pain?
In my chest area.
Okay. And when did that pain start?
Maybe a week into the cough.
Okay. And would you describe this pain as dull or sharp?
Sharp.
Sharp. And how long does it last?
Just during the coughing fits and a little bit of time after.
Okay. So it resolves on its own?
Yeah.
Okay. And on a scale of 0 to 10, 10 being the worst pain you've ever felt, what would you rate this pain?
Around a 3.
A 3. Okay. And have you experienced any other symptoms related in this time frame, like fever, chills, any muscle aches?
Just a little bit of chills.
And chills. Have you ever taken your temperature to see if you have a fever?
No.
Okay. So now I'm going to move on to the objective portion of the exam where I would complete a set of vital signs. I would note that Jacob's blood pressure is 120 on 80. His heart rate is 70. His respiratory rate is 16. His O2 saturation is 99% on room air, and his temperature is 36.7. He is afebrile, and these are all normal findings. I would also note that Jacob's posture is relaxed. His breathing is unlabored and equal rise and fall of chest. I'm not seeing any signs of cyanosis or clubbing of the fingernails, so these are all normal assessment findings. So Jacob, next what I'm going to do is I'm going to auscultate your lungs, okay? So I'm just going to start just below the clavicle here. And listening bilaterally. And Jacob, I'll just have you raise your arms so that I can assess the lateral aspect of your lung fields. also complete this bilaterally. Jacob, I'll just have you turn around so I can auscultate the posterior lung fields. So just starting at the top of the shoulders here. So that's great. Not hearing any extra sounds. You have good air entry into all of your lung fields. I'm not hearing any crackles or wheezes. So next I'm just going to place my hands on your back here just so that I can check for symmetrical movement of your lungs. The chest is rising and falling symmetrically. That's a normal finding. Okay, I'll have you turn back around, Jacob. And I'm just going to check temperature of the skin, just nice and warm. And now I'm going to palpate your chest for any masses, swelling, or deformities, okay? So I'm going to do this just with the pads of my fingers here. If it gets painful at any time, you can let me know. Okay, I'm not feeling any abnormalities, no swelling, no masses or deformities that I can feel. So next we're going to move on to perfusion assessment and listening to your cardiac valve sounds. So I'm just going to ask you a few questions. We already established that you're experiencing some chest pain, which you feel is related to the cough, and it resolves on its own. Are you ever experiencing any lightheadedness, dizziness, blurred vision, or visual disturbances?
Some dizziness.
Some dizziness, okay. And when is the dizziness occurring?
During and after the coughing fits.
Okay. And about how long does it last?
Just around 10 seconds.
Okay. And have you ever felt like you're going to faint?
No.
No, that's good. Okay. So next, I'm going to assess your pulses. I'm going to auscultate your carotid artery. Here I'm assessing for Bruet. So no Bruet is heard, which is a normal finding. So now I'm going to palpate your carotid pulse with the index and middle finger. And we assess this bilaterally. And when we're assessing the pulses, we are looking for equal rate, rhythm, and strength on each side. Let's move down to the radial pulse, which is located at the base of the thumb on the anterior lateral aspect of the arm. That's great. And again, bilaterally. And next I would assess for the femoral pulse. Jacob, is it okay if I press on your groin area to assess the femoral pulse?
Yep.
Okay. This would be a deep palpation to assess the femoral pulse. And again, I would do this bilaterally. Next, I'm checking for the popliteal pulse, which is located behind the knee. And again, I'm doing this bilaterally. And moving down, I'm just going to remove your sock, Jacob. And we're locating the dorsal pedal pulse on the top of the foot. And again, we would assess this bilaterally, as well as the posterotibial pulse. Okay, that's great. So I'm feeling equal rhythm, rate, and strength of all your pulses on both sides. Those are all normal findings, so that's great. Next, I'm going to auscultate your cardiac valves. So I'm going to start by landmarking, coming down from the clavicle. I'm finding the second intercostal space, the right sternal border, and here I'm auscultating the aortic valve, listening for the love dub, the dub being auscultated a bit louder on this location, which is a normal finding. Then I'm going to move over to the left sternal border of the second intercostal space. And here I'm listening to the pulmonic valve. Then locating the third intercostal space, also referred to as Erb's point, on the left sternal border. Then moving down to the fifth intercostal space, left sternal border. We're listening to the tricuspid valve. And then just moving over slightly to the left mid-clavicular fifth intercostal space. We're listening to the mitral valve. The apical pulse is also best assessed here. And we would assess for a full minute. Okay, that's great. Your heart rhythm is regular. I'm not hearing any extra sounds, no murmurs, so these are all normal findings. So the next step would be for the doctor to come in and see you and discuss treatment for your cough. Do you have any other concerns?
No, I don't think so.
Okay, it was great to meet you, Jay.